Lichen sclerosus et Atrophicus, LS&A. The typical location is on perianal or vulvar skin of postmenopausal elderly women. The clinical appearance is that of an atrophic, ivory-white plaque, with cigarette paper appearing epidermis. With time, it may produce atrophy and sclerosis of the area, Sclerosus vulvae in women, balanitis xerithica obliterans in men. However, it is not uncommon to see LS&A elsewhere on the body, particularly the trunk, and in younger patients. Not uncommonly, plaques of LS&A are indurated and bound down to the subcutaneous tissue, and in those cases the condition is usually associated with morphea, localized sclerosis. There is the opinion, by some, that LS&A is a superficial type of morphea, localized sclerosis. The histologic findings, however, are dissimilar enough to consider them different disorders, even if related. The histologic features of LS&A are characterized by hyperkeratosis with follicular plugging, a thin, atrophic epidermis with absence of rete ridges, and hydropic degeneration of the basal layer. Characteristically, the dermis shows an edematous, pale staining, and homogeneous band which involves the papillary dermis and even the most superficial part of the reticular dermis. That area is acellular and devoid of infiltrate, while a band like lymphocytic infiltrate is seen immediately below. In the case of LS&A, morphea overlap. The deep dermis shows changes characteristic of morphea in addition to the changes described for LS&A. Necrotic keratinocytes are seen in interface and lichenoid dermatitis, and they are characterized by eosinophilic cytoplasm and absence of nuclei. When the changes are early, a pycnotic nucleus may still remain in the cell. Dyskeratosis is a term used to describe this phenomenon, particularly when the nucleus is still present, as seen in actinic keratoses and squamous cell carcinoma. The necrosis of epidermal cells can be either isolated or confluent, and is presumably the result of lymphocyte-mediated apoptosis.